Hi, everyone. I'm Lisa Rounds, and I'm an editor at Minneapolis.St.Paul magazine. And I'm so excited to kick off our fourth session of Wellness Wednesday today. It's a new monthly series that we launched just this past year in partnership with Northwestern Health Sciences University. And we're highlighting hot topics in health and fitness and nutrition, all through the lens of natural and integrative care and non-invasive treatments. We've been tapping Northwestern Health Sciences faculty and clinic practitioners, and we've been discussing things like traditional Chinese medicine, including acupuncture, massage therapy, and chiropractic care. Northwestern Health Sciences University, in case you don't know them, is located right here in our backyard in Bloomington. And they really are a pioneer in natural healthcare education. They offer degree programs in all of the areas I just mentioned, including Chinese medicine and chiropractic. And their campus has clinics that are open to the public, and they provide services by certified practitioners. So our guest today is from one of those clinics, and I am delighted to introduce Dr. Greg DeNunzio, who is, hi, Dr. DeNunzio.
Hello.
He is the clinical lead at Northwestern Health Sciences University's Sweary Center for Clinical Biomechanics. He's a doctor of chiropractic, and he has many certifications, including in advanced sports performance, CrossFit, and many more. We are so lucky to have him and his vast experience in sports medicine and biomechanics. I have interviewed him over the years and really taken a lot of his advice. So welcome, Dr. DeNunzio.
Thank you so much for having me.
Before we dig in, I just wanted to encourage everyone to post any questions in the chat field in real time while we're talking. We'll either try to get to them when we're on the topic or at the end, but we would really love to hear from you and, get you to be a part of this conversation. So, Dr. DeNunzio, injury, which is the topic of this session, is unfortunately something that many people can relate to. And, it can be so discouraging because, as you know, it can kind of take you out of your routine, even just for a few days or sometimes months and longer. And I think what can even sort of compound that frustration is when people end up with injuries that seem to be more elusive and hard to diagnose. And so in talking to you over the last few years, I just, you've really shared some of this sort of foundational information about how we age and the different things that we need to think of. And I hope with this session that we can give our audience that kind of basic background and some tools, hopefully, to keep us active. So I will dive right in. I've seen a number, and it says something like women in as early as their late 20s already start to lose lean muscle mass, and that men in their early 30s. I wondered if you could just, is this true, and sort of what does it mean about how we should approach our fitness and our health in general?
Yeah, it is true. It happens, but it's more on the minimal side at those ages. You really start to see it in your 40s and especially in your 50s, just a natural part of the aging process. And there are two ways to go about it. And starting younger is good in a lot of ways, but especially because you form the habits, right? And so to address this, you can go about it two ways. You can do it with fitness, and you can do it with, well, lifestyle is part of fitness, but you could do it with diet also. So high protein foods, the fish, the chicken, lean meats, even if it's red meats, that's fine. Those types of things help with this. And then it goes to lifting, really. And so you have two aspects here. You have endurance type training and people who like to run, and you have people who are typically in the gym more and like to lift. And so to increase this lean muscle mass, you can lift, and you can lift higher weights, which gives you greater muscle mass, right? And you can use lower weights and higher repetitions and also gain it that way because you're burning more fat as you exercise. So there are a couple of routes to go in the gym as far as doing it, and you aid that or supplement that with a good diet to maintain the protein is needed for the muscle and muscle repair and that type of thing. So those are the elements that go into keeping lean muscle mass.
You know, Dr. DeNunzio, you've told me some about joint health, and again, it's something that in our youth we probably aren't thinking about our joints. Is there any kind of strength training that you can do to prevent that kind of deterioration, I guess?
Yeah, and this is a great question, and one I'm asked a lot. And I think the key to this is when we strengthen a joint, we tend to get into habits in what our exercises are when we exercise. And we always exercise in the same plane of motion, right? But we can move to the front, we can move to the side, we can move to different angles. And from what I've seen and experienced over 27 years of practice and longer in fitness, strengthening the joint at different angles the whole way around the joint is a great way to keep it healthy. Because you are stabilizing the entire joint that way. So in other words, you can do squats, that's fine, but then do lateral lunges or lunge back to 45-degree angle. I'm trying to give an example so people can picture it. That's what I'm talking about when I'm talking about exercising at different angles so that you strengthen the entire joint.
Wow. Are there more common injuries that you see in sort of your everyday athletes, not your professional athletes, but your weekend warriors? And
yep, most definitely. And two of them are the shoulder, because of the way it's attached, the shoulder joint, and the way it's formed. There could be very narrow space where those rotator cuff, I'll just talk in more general terms because I think people can identify with that. The rotator cuff musculature has a small space between bones to slide through, and just in the way we're structurally developed, sometimes going overhead can impinge that or irritate that. Plus, the shoulder is held into place by muscles that come over the top of the shoulder and pull it up into the socket. And so we see a lot of shoulder problems. And the other one is in the lower extremities. It's the knee. And the knee is, it's kind of caught in, not kind of, it is between the ankle or the foot and the hip. And when we see dysfunction at the ankle or foot and or at the hip, then a lot of times, because of the way the muscles attach and the knee being in between those two joints, we end up seeing knee pain. So a lot of times people have knee pain, and this goes into more of a general looking at injuries. We're a society of it hurts here, fix it here, but we need to look up and down the chain because there may be something going on below the knee that's causing it to alter in the way it moves, and that causes the injury. Or there could be something going on in the pelvis, and that has an effect on the knee. So we need to look through the whole chain to really see what goes on and where the source of the problem is, not just the source of the pain.
interesting. I was thinking also about now with our summer months, a lot of people prefer to be outside to get their exercise. rather than being at the gym. And so, of course, what the go-to exercise is running. I wondered if you could share any kind of preventative advice or sort of how to be smart about running.
Yeah, yeah. And so maybe this comes a little bit from the CrossFit background, but and we do this. My wife and I do this. You go out for a run and stop at a playground and do a couple rounds of 10 push-ups and 10 pull-ups and stay there for a little bit and then go on your way again. Then you're getting a full body workout, you're burning more calories, you're taking the stress off the legs. So it's not just running for 6, 8, 10, 12 miles, however long you may go. And again, it's another great way to address the lean body mass that we were talking about. So yeah, the variety to me is the key, not only in training each joint and area around different angles, but changing the workout up. You have to do that to change the stresses. It does two things. It gives the body time to rest when you go a little bit lighter, and it causes you to gain or increase metabolism, also especially basal metabolism when you're at rest. So the variety is the key for sure. So that would be my recommendation. It is, hey, why not? Then you get to a playground and you're like a little kid again. So you can do some things there and help yourself physically and break up your running routine. So,
You've told me before when, I was training for a race and you said, I think a lot of people, obviously, when you're training, you're trying to get up to your distance. But you said to me, runners think they need to run more, bikers think they need to bike more, and that actually we should be mixing in those activities and strength training as well. Is that something during our training, say for a race?
yeah. So let's just take the running, for example. You're running. You're doing the same thing over and over and over again. And I see this, it happens more so in the winter. So I've seen a lot of runners through the years in the clinic with different injuries. And for some reason, it goes up during the winter months. So why does that happen? People start running on a treadmill, right? So that pounding is the same force over and over and over again. And I tell my patients that you need to, if you like the treadmill, that's fine, but change the incline every couple of minutes, because every time you take a step outside, your foot strikes differently on the pavement. None of it is smooth, and so the forces are different. So yes, that mentality of more is better when you're doing the same movement. We associate repetitive motion injuries with the wrist, right? With people being at a computer, but it happens in other parts of the body too when we keep doing the same thing over and over again. And that, again, that's the key to the variety. You need to give that a little bit of a break so that it has time, the musculature has time to recover.
So even variety in the surface, you're saying, in outside, it's better, that variety.
Yes, I absolutely. And I do quite a bit of trail running. And so you can feel the difference. I feel the difference big time in my legs when I'm in grass or on a trail versus on the road. And while we're on that, just I had a chance 2 years ago or so to talk to a marathon group just the day before their marathon. So I didn't have a lot of time to work with them, obviously, but I said, think about one thing when you're running, think about landing softly, because I always get the question, should I change my gait? Well, I don't know that you should change it consciously, but if you think about landing softly, subconsciously, you're going to change your gait and get your feet underneath you where the forces are coming up through the center of your body more, and it's more efficient. And it's called economy of running. You use less energy. So that's if somebody on here, people listening are into running, that's one simple thing you can do right off the top. Just tell yourself to land softly, and you'll be surprised at the way it changes. I followed up with that group a week or two after the marathon, and just about every one of them who thought about doing that told me they felt more refreshed and more energy after that marathon than any other race that they ran. So.
Wow. Next question, can you talk a little bit about stretching? Sort of just in general, I think you told me another unfortunate thing, as we age, we tend to get a little tighter. So how important is stretching, and any sort of general tips on length of time?
Yeah, perfect. So yes, the research in all of this is kind of all over the board. Everybody has their findings, and so to stretch before an event may be good, but it's more important to get the blood flowing and loosen the muscle up so it's more elastic and can adapt better to the exercise. And not that stretching is bad beforehand, but getting the muscle warmed up is the most important. The best time to stretch is at the end of the exercise session when the muscle is hot, because the muscle has a plastic and an elastic property to it. So it's like heating up plastic, and you can pull it apart. As it cools down, it stays longer. So you get a greater lengthening or benefit when you hold the stretch on muscle that's warmed up. And you get a greater benefit if you're holding it longer. You don't go for 10 seconds. Go, and I know we get the workout in and we're good. We all want to go. We want to forget about the stretch, but hold the stretch for 60 seconds and go back and forth on each side 2 or 3 times. And that'll give you the greatest benefit. So it'll help you keep the strength, because to a certain degree, the longer the muscle it is, the stronger it is. And I would give students and patients the analogy of a rubber band. If you pull it way back and let go, it's going to fly across the room. If you pull it back just a little bit, it's just going to flop right over your hand. There's no energy there. So that's probably the most important time to stretch, when you're done with your workout.
Wow, great tips. I wanted to just address one question, a great question here. From Kim, can you address plant-based proteins for muscle repair?
Yeah, right. You know, a lot of this is, and I will be totally upfront, it's a little bit out, that nutritional part of it and what is best is a little bit out of my area of knowledge or expertise. I do know that the plant-based is very effective, because a lot of people with the whey protein and some of these other proteins have not so great reactions with them in their gut, and that's going to cause problems through joints and everything. So I probably would have to look into more of that to talk about the effectiveness of that, if I'm going to be honest with you. But I think any source of protein is going to help to a different degree. And I don't know a lot about it, but I know enough that some of these things need to be done in combination. Different proteins, when you're not getting a whole one from the meat, then you have to do different combinations to get the entire protein. So.
Thanks. I also was wondering, I've lost my screen. There you are. Dr. DeNunzio, how about rest? The importance of rest in our fitness.
Yes, a necessity that I laugh because I just had this conversation with somebody. It's easy for me to tell people that I'm training and my patients to do, but I have a hard time doing it myself. And pain is the indicator, right? We're motivated by pain. So we need the rest for, the biggest thing is the muscle repair, right? When we're training, when we're working out, I don't care if it's in the gym, lifting or running, we're tearing the muscle down. So the rest in combination with that diet and the proteins is what's going to help the muscle repair. We can't keep tearing it down and tearing it down. That's when we start to see the injuries, because the muscle weakens and we're putting more and more stress on it. And pretty soon we're off of what we're doing. We can't do it because we're feeling the discomfort. And I think this is common for a lot of people, because I would see it. I'm the type that If I'm seeing you as a patient, it's my job to get you out of the clinic, right? And I'm going to give you the things to do on your own. And so I would see people and I wouldn't see them for months, and they'd come back in and I'd ask how the routine was going, whatever I gave them. And they would say, I'm feeling great. So I kind of stopped doing it. Now I'm feeling it again. And that's human nature to an extent. Because again, I think we all want to get the workout in, but we don't want to rest or do the stretching afterwards to help ourselves recover from that. So the rest is needed big time for that muscular repair.
Question, how can you tell the difference between normal post-workout soreness and an injury that maybe could be aggravated?
Yep. Yeah. So, to be stiff, to have an achiness after your workout, and more so in the muscles, and sometimes it happens in the joints also, but that achiness, dullness, that's more, and stiffness is more of an indication of something that's gone on muscularly because of the workout, maybe an intense workout, or whether it's intense as far as weights or intense as far as running a long distance. Some more acute injuries will feel more sharp, or I guess I'll just leave it at sharp, but you'll feel the sensation a little more deeply and it'll catch your attention more.
Okay. So I wanted to ask you a little bit about, diagnosing injury. I personally went through an injury that took almost 2 years to diagnose. And I saw all sorts of specialists. I went to a chiropractor, a sports medicine doctor. I wonder, I had cortisone shots. And I guess, do you have any advice for people as they're sort of starting down this journey of an injury that might not be obvious, right? A knee maybe a little bit more easily diagnosed, but when you get into maybe other things like hips or hamstrings, any advice on kind of where to start?
Yeah, again, it kind of goes back to what we talked about earlier. We hurt in a certain place, so we think that it needs to be fixed there. And I can tell you in all my years, most of the time, and I don't have numbers here, but the area that is hurting is compensating for another area that's not working right. So there are what are called myofascial slings through the body, and they go from head to toe. So here's an example. I'm working on a doctorate now in kinesiology, and you follow these myofascial slings, and they have studies out there that say forward head tilt is a contributing factor to plantar fasciitis. Now, I guarantee you most of us aren't looking up at the cervical spine when we want to take care of plantar fasciitis, including myself, right? And so you start to make these connections when there are myofascial chains and lines that can get pretty detailed. But even if you look at the 6 or 7 major myofascial lines and follow them, that's what I've begun to do. And I will go in to see people and work in certain areas, and we'll kind of laugh because they'll be like, what's that have to do with where I'm hurting? And that's what we need to do to find out what is not moving right, what is not firing right, what is not strong. Wherever that dysfunction is along that whole line from head to toe, and not all of them go from head to toe, but we need to look more globally than just at the area that's injured. And I think more and more people are realizing that, more and more practitioners are realizing that, and it's a big deal. And that is, and I don't want to get off on it now, but that is part of the function of the SWERI clinic that I oversee, having multiple providers in there with different disciplines. If I don't see or get the response I want from you when I'm treating you after a few sessions, somebody else needs to take a look, or I need to take a step back and reevaluate what I'm doing. So anyway, I could go on and on about this, but it is looking in other areas that you really wouldn't think would have an effect on the area that you're hurting in. And we need to be more detailed and keep digging into the problem. And that's what our goal is at the clinic.
Interesting, because I think maybe it can become kind of a head game, right? When you're trying to pinpoint the problem, you're going to physical therapy and you're not really convinced that the exercises they give you are working. And so then you don't do them and then you just end up frustrated. But it's interesting you say you have different practitioners within the clinic. So can you give examples of the types of different areas?
Yeah. So we have a couple of chiropractors there that practice in different ways. And one of the things we have in this clinic is a 3D CT scanner. So we can see the upper cervical spine in 3 dimensions. And this goes a lot to concussions and head injuries, and I don't want to get too technical here, but cerebrospinal fluid flow and how that may or may not affect these types of injuries. And so we have a practitioner who looks at that, and we have another one who utilizes functional neurology. So he'll look at eye movements and what's going on deeper into the brain. And I know these 2 practitioners are working together on 1 or 2 cases, because when you put it together, it's even more powerful. So we have those 2 practitioners. We have physical therapy, corrective exercise folks with us. We're talking to a mental health provider right now, because as I probably learned more in the last 5 years than I have in the last 27, but the emotional factor of what's going on with injuries and breathing patterns, and we're always in this wound up state that doesn't let the muscle to relax, allow the muscle to relax to do what it should do. So we have areas covered in functional neurology, chiropractic, physical therapy. We have a dietitian, corrective exercise folks, and we're still looking for acupuncture, again, psychological practitioner, nurse practitioner, I've been talking to. So we really want to encompass as many disciplines as we can and put it all together.
I think you've got our next topic for a new article around mental health and how it affects muscle. That's fascinating to me. Of course, it makes sense. If you're relaxed or if you're tense, it affects your muscles. I have a couple of really great questions, but I wanted maybe for you to, I'd love for you to share a little bit about one very unique tool that you have at SWERI that we have a visual for, just sort of while you're talking about the clinic. So maybe I'll share the video and have you talk about what this is. All right.
So while you share, I'll talk.
All right.
So we have the other diagnostic tool that we have is a 3D Biomechanics Lab. So we can look at walking, gait, running, the squat movement. We can look at everything in 3 dimensions. And you see this person on the treadmill, and you can see the white line going up through in the top picture on the left. And that's the force vector going through. And when we see that from a front view, we can see where those forces land through the ankle. Yeah, perfect. This is perfect. So you can see on each side that those force vectors going up through the body. And we take a look at these and we can compare side to side as to where the forces in the body are landing. And we go up higher than this. We do some other assessments from the waist up, because it's all connected, or watch arm movement in the video, but we can digitize the entire body to see what's going on here. And this gives us a great amount of information. Typically, these labs are used for research, but we've opened it up to the public and have different packages that people can, depending on if they're working with a practitioner, who I would also work with. We get the findings for them, and the people can take the findings back to their personal trainer, their physician, chiropractor, whoever it may be. And we give the findings of what we see, and then sometimes we're asked to give the recommendations as to what I would do to address the situation. And to me, that's the beauty of working with other practitioners, not just in the SWRI clinic, but outside of our clinic, we get referrals from other clinics. And I tell the practitioners there, look at this as though you would an MRI. We're here to give you greater detail of information as to what's going on with your patient, and you can hopefully make a better treatment plan with that. And so again, it goes to collaboration, whether it's within the SWRI clinic or outside of it. We need to work together as practitioners and put the patient in the center of the equation to get them better. That's what we're looking to do.
And is this 3D analysis, there are very few of this type, is that right?
Yeah. Yep, there are a few in the metro area. Again, most are used for research. Well, I can tell you Children's Hospital in St. Paul has it. They do research, and the Mayo Clinic does it, and they have down in Rochester, and they have packages for, to be fair, they have packages for people to go in there. We just think we've made it a little more cost effective, but it doesn't matter where you go to get this analysis. It's very valuable, and it gives you insight. It goes to the other angles that I was talking about when we train, right? We can see the forces at all different angles on the body versus if I just watch you, well, I can't measure the forces for one, I can see the angles, but I can only see them in 2 dimensions. So it gives us greater detail, and that's the bottom line.
And what type of patient are you seeing
Yep.
for this analysis?
Yeah, we see, so we've done gait analysis on Olympic sprinters. We've done them on some of our best Olympic distance runners here in Minnesota, but we've also, probably one of the most rewarding is somebody came in with, she had a stroke like 14 years before she saw us, and we were able to analyze her and give her some more things to do. And she did remarkable with her initial recovery. Whoever who treated her, they did a fantastic job, but she was a kind who wanted more. And so we were able to give her a few more things to improve her. And another one was somebody who had a surgery on their foot, on one of their toes, which caused them to land differently every time they walked and ran. And between chiropractic treatment and some soft tissue work and some exercises, again, we didn't take all of her pain away, but we made the quality of life better for her from what she told us. So,
Wow.
you know, people with dizziness, balance issues, I don't want to segment this just into athletes because there's a whole number of demographics out there that could utilize this analysis.
Wow, I'm going to get to a couple of questions here. We have someone from the audience. I'm 51. My knees have started crackling every time I climb stairs. It doesn't hurt, but it's loud. I walk about 4 miles a day and keep active with pets and kids. Would strength training in combination with a good diet help with the crackling, or is there something else going on? What advice do you have?
Yeah, I think to something like that, the strength training in all planes of motion, and it doesn't have to be intense, just get moving laterally or back at a 45-degree angle or forward at a 45-degree angle. And I think that'll go a long way in helping that. The other thing, what I do know a bit about is glucosamine and chondroitin, and they help with cartilage repair. So supplement-wise, you could look at those 2 things. Again, glucosamine and chondroitin have been shown to be effective in helping with that cartilage type problem here. So the other thing, you know, to have that assessed to see the way the patella is tracking would be interesting, because there may be some imbalance from one side of the quad, the outside of the quad to the inside of the quad. There may be a strength difference there that's affecting that. So the patella doesn't track through the grooves the way it should. And that may be part of what you're hearing, especially as you take a step up a step and your body weight's coming back down on the knee. So there are a number of things to do, but I would start off with training in different planes of motion for sure.
Great. Another one, you mentioned that you're a trail runner, which means you're running on an unpaved surface. Can you share what kind of benefits you've personally reaped from this type of running, especially for someone who has treadmill or asphalt fatigue?
Yeah, I think it, inherently here, we don't even think about it, but the way you're strengthening the joint, because every time you land, your foot's landing a little bit differently. Your body has to adjust to that. Muscles that you may not utilize to any great extent when you're running on a treadmill or even straight down a road will have to become engaged to help you stabilize. And I think that's a huge asset. And to me personally, at 60 and running since 7th grade, I've never had anything that has stopped me from running. And I think it's the variety. And as I've gotten older here, it's more to that change of surface, a little softer surface to take the stress off the joints. So.
Wow, lucky. Um, so from our very own Jen Martone, our Iron Woman from Minneapolis-St.Paul, she asks, if an athlete isn't working with a physical therapist, can they still make an appointment for a 3D analysis so they can see if their gait is off? For example, to make sure their glutes are firing, their hips aren't dropping, etc., to ensure good form while training for endurance events.
Yes. So what happens is a lot of people will come in and they'll work just with me in this kind of situation, and we'll do the analysis, we'll do the findings, then I'll give the recommendations of what they should do. And I'm very much a hands-on. I'm not here are a bunch of exercises, take them and go do them. I need to be with the person to make sure they're doing them correctly. And it's interesting, some of the elements that she brought up there. I've been working with folks at the University of Minnesota, and we're looking at neurolymphatic reflexes and actually different points around the body that stimulate the muscle to activate and fire. So just to keep it short here, a lot of times we'll see something and we say, okay, you need more flexibility, you need to stretch that, or you need to strengthen it. But if the muscle fibers are locked in because the nervous system isn't stimulating the muscle properly, and we don't get the sliding of these filaments, then we may get a benefit out of stretching and strengthening, but it's not going to be to the greatest degree that we can. So there are other aspects that I look at when people come in also. It's not just those forces and just those angles. It's other elements of the nervous system also that contribute to that need to be addressed.
Interesting. We did have a couple people submit questions earlier. My left hip is apparently turned inward, went to physical therapy last year, but still have pain and cannot fully bend the knee. Any advice?
Yeah, so I'm not sure exactly what the physical therapist did, but some of the internal rotators, and this is where we get into posture and what people do day in and day out. Also, the muscle called the sartorius comes across the front of the quad into the medial aspect of the knee that pulls the leg kind of across your body. The abductors, ADD, in the medial part of the thigh. I don't know what's been done to address those. But that should be looked at. And then the piriformis and some of the muscles through the glute that externally rotate. So what is the problem? Is it something, if I were approaching this, I would say, is it something that's pulling the hip in, or is it something that is weak on the other side, like the external rotators and the abductors? So again, and this is an instance where I might follow a myofascial chain to look up and down that chain to see what else may be not working right. Because sometimes we'll see it in the upper back or the lats, even though they're feeling that in the hips, something above or below may need to be released there.
Okay. Another person asking any just general advice around knee recovering from knee injuries?
Yeah, again, I don't know what the injury was, but if you're feeling better now when you start to train, and I don't know what caused the injury, but the strength training in those planes of motion, jumping and landing softly, it depends on what your physical activity is. I don't know if the modality is more endurance with this person or in the gym, but those types of things will help a great deal. I can't emphasize enough that we move typically in one plane of motion, and we need to strengthen the joints, knee, shoulder, ankle, I don't care what it is, we need to strengthen those in all planes of motion to get that stability there.
Wonderful. your answer to Jen's question. Are you able to work with someone that has a knee or hip replacement? So with the 3D analysis.
Yes, and we already actually I left that example out. Yes, we can. Yep, we'll look at what's going on there and potential imbalances. And I want to make it clear to everybody, we're not built symmetrically. So we can, sometimes it takes just a little bit of change in one area to make a big impact overall. So we don't necessarily look to see if everything is exactly the same on one side or the other or front to back. But we look within some norms there. We have a lot of studies and a lot of data, what goes on at different parts of the body. So we look at that for sure.
Great. From Jamie, my joints feel stiffer since I had a baby 8 months ago. I haven't looked into this just yet, but thought I'd ask if there's something there. Have you treated or heard of postpartum women with joint issues post-pregnancy in the clinic?
No, but we have a great practitioner who does. As far as me personally, my sense is that maybe during the pregnancy and through delivery, as you're pregnant and the relaxin, the hormones release to make the ligaments and stuff a little more flexible for birth, in preparation for birth. Maybe afterwards, as those start to tighten up, maybe you're feeling that a little more. And I don't know what stretching has been done since birth, but that would be my sense of what you're feeling and what's going on. And maybe it's more tight now before you were pregnant, and but that sensation is probably what you're feeling.
And you have a practitioner at Sweary who treats postpartum?
There is a Dr. Ann Spicer is actually in the Bloomington clinic. She's a colleague I've known for 20 some years, and she specializes in women and children's health. So I would absolutely not hesitate to have somebody look her up, Dr. Ann Spicer. Yeah.
We have interviewed her in the past, we know. Another one, I'm 26 and got into long distance bike riding in the last year. I'm currently training to do a 100-mile bike ride. I don't currently have any pain, but what advice do you have as I am training to avoid injury?
Yeah, so here's a good one for everybody, but especially on the bike. Make sure you're getting off of that to train in different ways, even if it's a short run, but specific to you and being on the bike. We need to look a little bit closer at the psoas muscle and our breathing patterns. So the psoas is the main hip flexor, which is going to be really engaged when you're on that bike because you're seated, and that's what's driving you a great deal. And so what I talk to people about is a breathing pattern, and put their hand on their stomach at night and take deep breaths and breathe through your stomach. That will relax the diaphragm, relax the psoas, and take a bit of the stress off the hips and allow the psoas to fire the way it should. It's the only muscle that connects the upper body to the lower body. It attaches into the lumbar spine and the pelvis. And if I could tell you anything, I know it sounds crazy because it's not directly addressing a muscle with strength or stretching, but a breathing pattern, and we're seeing this with a lot of injuries, is a huge deal when you're in that posture. So make sure you're relaxed because when you're not, the diaphragm tightens up, the psoas is connected to it, it tightens up. You're also in a forward flex position, so that psoas is shortened already, and you need to make sure that it stays engaged as far as muscle firing, and relaxing is the best way to do it.
Wow, so breathing pattern while you're on the bike, while you're in that position.
Well, more so like at night. Practice that off of the bike. Sorry, yeah, I need to make this clear. So I tell people when they go to bed, put their hand on their stomach, feel their belly rise and fall, and do that for however long it takes. It doesn't matter, but start to get into that habit. Then you'll realize that subconsciously you'll do it when you're driving or when you're on the bike or wherever else you are. But start to get that habit to feel your stomach rise and fall versus breathing through your chest.
Wow. I wanted to ask lower back. Do you have any advice for getting ahead of those tweaks? I think you once told me, I mean, I've had them through the years. And then, I just know I have 3 days where I can't do anything. when I tweak my back. You told me you once had someone, maybe was it on the 3D analysis, when they tweaked a muscle or something, that you could actually see it in live. Just any advice in general for people suffering from lower back?
Yeah, so lower back, again, it goes, so I'll just speak for our profession, and not everybody, but we get lower back injuries when we want to go right to the spine with looking at the spine from behind the person, and which we should. But that psoas muscle is attached to the lumbar spine. So that needs to be looked at. And then as far as strengthening, and I've gotten into this in the program I'm in now also, some of the most effective core strengthening exercises are unilateral upper extremity exercises. So in other words, if you have a cable machine and you want to do a chest press, you stand in a staggered stance like you're walking. So if you had the cable in your right hand, your left foot would be forward and you press straight out. So that causes the strengthening to occur in a pattern that those myofascial slings run, at least some of them. And that is some of the most effective core training, because people, if they hurt their low back, they think they'd have to strengthen their low back. And
Right.
so on average, we've been down to pick something up 5,000 times a month. Well, our low back's doing a lot of work already, but I say to patients, do you do 5,000 core strengthening ab workouts type repetitions per month? You know, we need to balance that out and strengthen the other side. And we see this across a lot of joints. One side of the joint is a lot stronger than the other side of the joint. The shoulder, for example, and then you tear a rotator cuff. So that balance has to be there, the strength between the core or the abs and some of the detail. We don't need to name the muscles, but everybody gets the idea that strengthening through the abs has to balance out to strengthen the low back. So.
Wow, and it's kind of unexpected to where you're talking about upper body strength training to strengthen your core.
Right. Yep. And hey, that's not too. Planks are they're a great core exercise also, right? Front planks, side planks, those are great. But there are other ways to do it that give you a more global strengthening so that there isn't compensation through those chains in another area. And that's where my focus has come the last handful of years. So.
Wow. Another question. I have a tilted pelvis, which I believe is not uncommon, but it seems to contribute to lower back or SI joint pain. Anything I should be doing proactively to help prevent these episodes?
Yeah, so I guess it could be tilted forward, which causes more of an arch in the low back, and typically that'll cause pain from the vertebrae themselves, the facet joints, or I don't know if it's tilted posteriorly or back, that flattens the curve in the lumbar spine, which if there's any disc issue, that'll push the disc back and cause discomfort. So kind of, I'm sitting on the fence with an answer here because it kind of depends on where that's coming from, which way the pelvis is tilted. So if it's tilted anteriorly, then you have to release those hip flexors and you have to look at strength through the hamstrings and that to try to balance that out a little bit. And if it's tipped posteriorly, then we need to maybe loosen some muscles through the lumbar spine and strengthen some musculature in the front of the pelvis or the hip flexor area, whether that's the quads or the psoas or whatever it may be. So it all depends on which way it's tipping there.
Okay.
What you do.
We've got about 7 minutes left, and I have a few things I want to mention to everyone before we leave. I had one topic that it's kind of a big one, so I'll throw it out there, but I know you won't be able to address it fully. I guess I was interested. Obviously, we've all had a crash course in sort of the devastation of the opioid epidemic. We know that a lot of times it can be an injury that turns into chronic pain that starts the medication. I guess I just wanted you to give a little general rule on how kind of at SWERI and at Northwestern Health Sciences University, how your approach is different, I guess, than medication.
Yeah, so it goes to, and it's, you know, sometimes the medication is needed, but it goes to a couple of things. One, and this is no different than the stretching where we put it off. We start to feel something that doesn't feel right, but we keep thinking it's going to go away. And I don't care where you go for care, but try to address it as soon as you can, because as soon as you start to feel it, then the body's starting to adapt to that, and compensations occur and muscles tighten in certain areas that shouldn't, and whatever that compensation is, the body's always going to want to stabilize. So number one is when you start to feel something and you know it's not right, seek out the care wherever it is. Two, as far as the SWERI clinic, maybe this is a little bit repetitive, but we go to, hey, we all can look at the same injury at a different angle depending on our area of expertise or our interest. And that is what is so rewarding about this, because not one of us has the answer all the time, and we need to set the ego aside and consult with a colleague. So having multiple people look at the same problem with input from those people, we're seeing and hoping that it continues, that this helps to resolve the injuries without the traditional medication. And again, that's not to say sometimes it's not needed. The other thing there is, with a dietitian, we can address this through more natural means. We have a lab in the university that we can do blood draws if we need to see where people are deficient in certain elements that may be contributing to their injury, so that we can help more naturally that way. And a fantastic store there that we have supplements, and we know that we buy from companies who research their products. And so, because there's a lot, and I was a big skeptic about this, I will admit, it's like, okay, I'm taking these, but are we absorbing these minerals, elements, vitamins, whatever they may be? And so I have great confidence, and our bookstore does a great job of getting these products in there. So that whole world there with all of those elements put together, I think we're able to get to these problems with the help of the patient in getting in a timely manner and resolve them without having to take those further steps. So.
Thank you. I love the advice of just addressing it right away, because I think a lot of people don't do that. They just figure it's nothing or it'll work itself out. And the fact that you start to compensate for it. And that's great advice. So we're going to wrap it up here. I just wanted to, just some housekeeping. This session will be recorded, and it has been recorded, and it'll be posted by this weekend. I also wanted to let everybody know that we have a couple more great sessions coming up. On July 14th, our Wellness Wednesday, we're doing a part 2 for our sleep and the Chinese medicine body clock, because there was so much interest after our first session. So that is on July 14th. And July 21st, we're going to be talking about gut health. And we have a great naturopathic doctor who is going to be talking about gut health on July 21st. So please do go ahead and look at our mspmag.com on our health and fitness tab. And then Dr. DeNunzio, I just so appreciate all of your advice and your time. So
thank you. Thank you. I love it. I hope it was helpful, and I enjoyed doing it. So I appreciate the time to do it too.
Great. Thanks, everyone.
Thanks
for joining.